Well, welcome everyone. Thank you for joining us today. Hi, my name is April Lee, COO at ARC Fertility, and I'd like to do just a little bit of housekeeping right here to start us off with. Certainly, I'm sure you'll have questions along the way, and if you'll put them in the chat, we'll answer them as best we can, and then any remaining we'll either answer at the end of the session or as a follow-up question. We want you to know that there'll be a lot of detail covered today, so not to worry. You'll be getting a copy of the slides and a toolkit, along with 2 pieces of material, a white paper, and an AMWA case study. So again, thank you for joining us today for this webinar. It does reflect a groundbreaking collaboration between the American Medical Women's Association. Thank you, Eliza, and the Leapfrog Group. Thank you, Jill and team, and ARC Fertility. And we're going to talk about and discuss with you how to identify high-value family-forming benefits. As a member of the Leapfrog Partner Advisory Committee, ARC is committed to shaping the future of family-forming benefits, and this webinar represents our dedication to advancing innovation and industry dialogue with all of you. During the session, the esteemed leaders, Dr. David Adamson, founder and CEO of ARC Fertility, and Dr. Eliza Chen, Executive Director of the American Medical Women's Association, will provide insights into the role of family-forming benefits to improve clinical outcomes and the quality of life for employees, which is so important. With Dr. David Adamson's experience and expertise worldwide in the industry, with recognition as an industry pioneer, coupled with Dr. Chen's esteemed accomplishments and advocacy for women's health, the webinar will address some key metrics for addressing quality and cost effectiveness of fertility benefits, along with highlighting positive return on investment, which is so important, and also the value of an investment for an employer. So with that said, I'm going to turn it over to Dr. David Adamson and Eliza Chen, but we're going to cover just 2 more things, and that is, or 3 more things, the learning objectives. We hope that when you walk away, we will have explained, why fertility and family-forming benefits matter, the 3 metrics that can be used to assess quality and cost of a family-forming benefit, and at least 5 ways that a family-forming benefit does deliver ROI and VOI. And with that said, again, very honored to be with you today. And David and Eliza, I'll turn it over to you.
Thanks very much, April. It's great to be here with Eliza and with Leapfrog and Jill. We want to thank you very much for helping organize this webinar today. So let's get started right away with the first question about why do family-forming benefits matter anyway? Because for many years, people didn't pay much attention to it. But the reality of it is that infertility is a very common problem, affects about 1 out of 6 couples in a recent WHO study. And many singles and LGBTQ+ also need help forming families throughout their life. So this results in a very high proportion of people, probably at least 20 to 25% of your employees at some point in their life are going to have a challenge forming their family. And what we know about family-forming benefits is that they really improve the emotional health of employees, and we know how important that is for increasing employee engagement. And of course, when engagement goes up, a lot of good things happen in the company. This includes the fact that family-forming benefits, when they include singles and LGBTQ+, really address a lot of diversity, equity, inclusion, and belonging goals. They also address a lot of social determinants of health, which we'll hear a bit more about, in that many marginalized communities, all marginalized communities, in fact, have less access to quality and safe care than the majority population. And we know that having these benefits really helps to improve culture within a company. It's also been well shown and documented that when you have a better culture and engagement of employees, unsurprisingly, you really can help retain and recruit employees, which is so important these days in the current market. And so now Eliza is going to give us some more perspectives on infertility.
Thank you so much, David. I'm honored again to be here to speak with you all about an issue that is really near and dear to our heart in the American Medical Women's Association. A few years ago, a call to action paper came out that really woke us up to the situation of infertility. At that time, infertility affected 1 in 8 women in the general population, but we were shocked to see that the rates were actually double that for women physicians, women in medicine. Of course, we now know that the numbers have gone up even more in the general population. It's now more like 1 in 6. So we can only imagine what impact that now has for women physicians and women in medicine. And of course, more data I'm sure will be coming out soon. And so for us in particular, as women physicians, the convergence of medical training during the peak childbearing years creates this conundrum and leads to the situation where many women have deferred childbearing because of their training years, spending all the years in their training caring for other patients. And then when they're ready to start a family, they find out that their hurdles are much larger than they imagine. And so we are trying to create awareness of this issue so that people can be more prepared and address these issues, be more knowledgeable to make the decisions that they need to make. And the women are starting to speak up. So even in the general press, there was a Time magazine article in 2019 titled, "I spent my fertile years training to be a surgeon. Now it might be too late for me to have a baby," by Dr. Arga Salas. A New York Times article in 2021, "A Medical Career at a Cost, Infertility," which featured Dr. Ariella Marshall, one of our leaders. Good Morning American piece, "With infertility, it took nearly 900 needles to bring my son into the world," by Dr. Erica Kay. And it's been found that women with infertility have high rates of anxiety and depression, almost as high as the women with cancer, heart disease, and HIV. And worse yet, while some of these diagnoses people feel comfortable sharing more publicly or with their close friends, infertility tends to be a much more private matter. In fact, many individuals will withdraw. They don't want to be with friends who have children. They don't want to hear about announcements. These become very, very difficult. And so it's a very long, arduous, often lonely journeys with doctor visits, imaging studies, injections, cycle after cycle. So I just wanted to kind of share with you kind of the general situation that we face as women in medicine, which of course impacts all women in the general population.
That's great, Eliza. Thanks very much for giving some of the real details of the personal challenges. And so the good news is, though, that employers are really starting to recognize these challenges that their employees are having. And of course, with Leapfrog, we're dealing with the medical community. And so many of the employees that we're talking about here, of course, are in the organizations and hospitals and companies that Leapfrog is working with. And so employers are finding that 70% of millennials would change jobs to get fertility benefits, and that when these are provided, there's a significant proportion that have increased loyalty to their employer. 58% of benefits leaders think it's going to be discriminatory not to offer these benefits by 2025, by next year. And what's really important is that 97% of employers who put in fertility benefits said did not significantly increase the cost. And we're going to show you today how these benefits can be put in with quality, with safety, and at very, very cost effectively. Liza?
Great. So why do companies include fertility benefits? As David mentioned, there are many, many good points about that in terms of ensuring employee well-being. And it was really led early on by the tech industry, where they were providing these benefits in order to attract and bring on good talent. And it really paid off. People paid attention to it. Those companies that did offer fertility benefits were seen as family-friendly employers. And as David mentioned, surprisingly, the costs were not as high as people thought. In fact, there were actually cost savings involved in that as well, because when you offer insurance, people make better decisions in fertility care. And one example, I think, David, you'll probably go into later, is in some of the decisions with the number of embryos to implant. If you don't have insurance, you're not going to be able to pay for many cycles, and so you're going to do more, and that, of course, has some other consequences that may increase costs later on.
Great. Thanks very much, Eliza. So we're going to move on now to our first question, and we're going to do a poll here. You can read the question. I think the poll question will be brought up, and ask which of the following characteristics of family forming benefits matter to you, and you can choose any number that apply, that they're inclusive of everyone, comprehensive for all types of journeys, that they're targeted to specific treatments, or they're integrated in the general medical plan. So what do you think are the characteristics that are most important? That's question 3, I think, Nick. Should be question 1. There we go. Thank you. So Nick, you'll let me know when everyone's voted. Okay, great. So these are good answers. So inclusivity, we think is important. Many employers want to decide whether they'll include, for example, egg freezing or surrogacy or egg or embryo donation. That's a choice for employers. Obviously, I know that M1R, I think it's a good idea that every employee can have coverage. Comprehensive, yes, that's important, that the journey is so different. We'll go into that a bit more in a few minutes. Really good understanding here about the targeted to specific treatments. One of the problems is that if benefits programs, and there are a lot of them out there that are targeted to specific treatments, what happens then is 2 things. Number one, those specific treatments may not be appropriate for all people. So some people are going to be left out because they don't need what those specific treatments are. And secondly, when specific treatments such as intrauterine insemination are prescribed and the people have to use them before other treatments, it tends to be inefficient and wasteful. So generally speaking, targeting specific treatments is not going to be very cost effective and won't be inclusive. And one of the big issues, there's good understanding here already about the issues with the general medical plan. While certainly having fertility in the general medical plan is better than having no coverage at all, the problem with benefits in a general medical plan are that they're not inclusive because the ACA, Obamacare, does not allow some types of needed family forming benefits to be provided. For example, often donor sperm, eggs, or embryo are not covered, surrogacy is not covered, and of course you can't put adoption in it. And so if the program is integrated in general medical plan, it will not be inclusive of everyone, and it won't be comprehensive. The other issues are that the care is commonly not provided by real specialists in a general medical plan, and so it's not as safe. There's a higher risk of multiple births and twins in particular. And of course, because in the general medical plan, there are often treatments that must be carried out there, it's more inefficient, and it's not cost effective, and the care is not appropriately managed. And so while putting something in general medical plan, it can be a way to get started in some cases, it is not. It is almost never the best approach to really having a high quality, cost effective, and safe plan. But so thank you very much for your comments on that. We'll move on now to the next slide. Okay. And this is talking about how we can create a high value personalized approach. Now, everyone here will know that high value is described as a high level of quality over a lower cost, so quality over cost, and flexibility really matters. The quality, of course, comes down to the outcomes, in particular, not having bad outcomes, the employee and the employer experience. It comes down to the cost, and it's really important to look at the total cost, of course, but we have to look at how that's broken down to the employee and the employer, because a lot of costs now, because of the high cost of medical care, is shifted to the employee, which in practical terms often means that they don't really have coverage if they have high deductible plans. So it's not only the total cost, but the distribution of these costs. And of course, it's important to be flexible because every employee is different and every company is different, has different needs for their particular company. So let's go into quality in a little bit more detail and talk about how we can get quality. Now, our company and I myself have really had a long-term professional commitment to increasing access to quality care in every different way we could do that in my clinic, but also through other activities. I've been very fortunate to see patients for over 30 years and started and built an IVF clinic that was then ultimately merged with the Palo Alto Medical Foundation. I'm a professor at Stanford and UCSF and have 300 publications in medical literature. And many of those, of course, are around infertility, endometriosis, and IVF, but a lot of them are around cost-effective care, safe care, how to get good outcomes, and how to increase access to care. How do you measure quality, good outcomes? What are they, in fact? Along the way, I've been very privileged to be president of the American Society for Reproductive Medicine and the Society for Assisted Reproductive Technology, respectively, the world's largest reproductive medicine and IVF organizations, and also was really privileged to spend 9 years on the executive committee of National Resolve, which is the consumer education advocacy and support organization. And through these experiences and working with many colleagues and leaders that I had the opportunity to work with, we together created ARC Fertility in 1997. And we put together a vetted network. We have a quarter of all the IVF doctors in the country in over 250 locations all across the United States. And all the doctors are vetted. They're board certified. They have to commit in writing to practice evidence-based care and ethical care. We have, in fact, removed members from the network on a handful of cases when that did not happen. And so we're very serious about having a vetted network of high-quality doctors, and also all of our partners, genetics companies, drug companies, sperm, egg, embryo donation companies that we work with are all vetted. And because we have good doctors and we have them commit to high-quality care in evidence-based, individualized packages. So over the years, knowing how to practice medicine in this area, we created individualized packages, all evidence-based. And so there are thousands of these, dozens with each clinic, that can meet the need of any given patient. And so our physicians have committed in advance to following this care that they individualize for each patient, but all is based on evidence. And then we wrap this top quality care into a digital program with a robust Fertility Now app, one-on-one concierge care, because navigation is so difficult through the healthcare system and then our centers of excellence. And we've been documented by the Validation Institute to have a twin rate of 20% or more lower than non-ARC clinics in the country. We've won the Fertility Sector Award for the last 4 years. And we've also been shown to save employers $20 million a year because of lower twin rates. And so just very briefly, I will not go through this in detail, but we know that navigation is so important these days. People need help in the system. And so the employees will call our company and they'll talk to their own personal navigator, find out about their plan, get referred to the resources they need, make sure everything's authorized. They'll have a consultation. Only the doctor and the patient make the decision about their care. We think this is critical for quality care. The patient and the doctor make decisions, not our company or somebody at a distance. All the services are lined up. All the funds are obtained from employers, sometimes from lenders, from the patient, and then the employee has their care, and the navigator follows them through their care, and our clinic partnership team also interacts with the clinic. So a lot of navigation, as we all know today, is needed to get comprehensive, seamless care. And we do this from the beginning of the journey throughout with a lot of emotional health support along the way. And we start this whole journey, of course, digitally, because 70% of all incoming information is digital these days. And so our Fertility Now app has sections for general frequently asked questions. One of the biggest problems in our country now is people don't really understand reproductive health and how they can do things to reduce their risk of problems. For example, diet, weight, exercise, not smoking, not using drugs. Also, of course, planning when they're going to have kids so they're not too old. And so we have a lot about how one can lead a healthy life and prevent problems. And then we have inclusive sections for people who want to get pregnant on their own, who need medical help, those in the LGBTQ plus community, those with emotional challenges, which many, many people have during a fertility journey. And we have sections for both women and for men. And from these, each of these sections, there's comprehensive questions and drop downs with based on the answers, personalized content that's all evidence-based, written for consumers, also integrated with prognostic tools about what's the cost going to be, how long it's going to take, and then a lot of emotional support using validated questionnaires, and of course, a lot of information about benefits, because we know how much people, struggle through healthcare journeys. So, it's important that the employees get this really high quality, personal touch, educational, informative care and high quality care. But what do employers need? Because they don't put benefits in unless they see that they're going to work for them. Well, they want to see a flexible program that meets for them. It's got to be end to end from early and reproductive life all the way through, and a hybrid program, meaning it's digital, it's one-on-one touch, but it's also medical care. You have to provide medical care in the end. And they want to see a good employee experience, because otherwise they have complaints and problems, which they don't want. But in addition to that, employers got to be affordable because they all have budgets and businesses challenging. They've got to be high value, as we mentioned, easy to implement and manageable, so they don't have a lot of issues as people are going through it, and promote their company goals. So there's a lot of goals for quality programs and safe programs, and they can be met, but it only comes from a deep knowledge of what's required by the employers and by the employees. So, Eliza, now you'd like to talk a little bit about quality. I know that's a very important aspect of AMWA's mission.
Yeah, thank you so much for that. And yes, definitely, as an organization of women physicians, quality is incredibly important to AMWA. And David, I loved how you kind of framed quality as to all the different stakeholders. So quality in terms of medical outcomes is incredibly important. Not making decisions based on cost, having a plan where people can make decisions that are the best for them, that are evidence-based, and that are individualized for each person who is undergoing this journey. And I would also emphasize that this is really a journey. This isn't like, a surgical procedure, a one-time thing. Infertility is a journey. So having the support along that journey becomes incredibly important, because it's not just the doctor visits, it's all the questions that happen in between. And so, David, I'm glad you highlighted some elements of your program that help address that journey piece and that individualized care. And then, of course, from the employer side, what is quality? And again, a flexible coverage plan that meets the need of the different employees and overall leads to a positive employee experience. And I think for us in AMWA, as a physician group, being able to have physician experts on the fertility side have been really key. We've learned an incredible amount from you, David, about fertility and fertility care. And so I just wanted to highlight quality is incredibly important, and the emphasis on evidence-based care, which we talk a lot about in medicine. It's not just about anecdotal or experience, it's about what has shown in peer-reviewed studies to work, and that is the kind of medicine that we want to practice and want to be referring our patients and employees to.
That's great, Eliza. Thanks very much. So we're going to move on to our next question now. And Nick, can we put up question 2? And it's, what do you think are the major shortcomings of family forming benefits today? And this multiple choice, you choose all that you want. That family forming benefits are not included in benefits. Is that a shortcoming? Employers don't know how much they're paying for family forming benefits. Quality of care is not managed, and the cost of care is not managed. So we'll give you a few seconds here to answer these questions, and Nick will put that up for us. Okay, great. So these are really strong answers. Yes, it is a major issue that family forming benefits are not included in most of the major health plans. They are included in some. When they are included, they tend to be the earlier, simpler treatments, such as intrauterine insemination or IUI. And in fact, as we mentioned a little bit earlier, one of the issues is that many of the major health plans require a patient to go through 3 or 4 or even 6 cycles of intrauterine insemination before moving on to another treatment, for example, possibly in vitro fertilization or IVF. And certainly there are some patients for whom the intrauterine insemination is the appropriate care, but often it's not. And so, and then if the patient does need to have IVF, or they need to use a donor sperm, egg, or embryo, or a surrogate, then those benefits are not covered. So it is a major shortcoming that family forming benefits are not included. It's important that they really be comprehensive, and it's almost impossible to do this in a general medical plan. The other issue is the employers don't know how much they're paying for family forming benefits, and this is actually true that they don't. And here's the reason why. It's well documented that when employees have infertility, but they're not getting pregnant, and they go to their doctor, it's usually their OBGYN. And if they don't have benefits, the OBGYN can often say, well, we can do some ovarian stimulation or ovulation induction or some simple treatments, and we can code that out as endometriosis or fibroids or pelvic pain or adhesions. And this is actually a very common occurrence. The estimates are that somewhere between 10% to 40% of the cost of actual appropriate care can sometimes be wasted on what this is called miscoding, when fertility care is actually provided in the general medical plan, even though it's actually not a covered benefit. And so this does result in costs that the employers are not even aware of. And then, of course, when such care is provided, as Eliza pointed out earlier, it's not unusual for people to make risky choices because they don't have the coverage to go on to appropriate IVF or whatever. So they have too much ovarian stimulation drug, they ovulate too many eggs, and they end up with multiples. And then the employer ends up paying for a twin or, heaven forbid, a triplet pregnancy that could have been avoided if the appropriate care had been provided in the first place. And often it's difficult for employers to recognize that these additional maternity and NICU costs end up in their medical plan that wouldn't have happened if they'd had a good family forming benefit plan. The other issue is that the quality of care is generally not managed in the BUCA plans. There still are a lot of family forming benefits in BUCA plans, but again, they're usually exceptionally rudimentary, don't begin to cover what's needed. At the very most, they cover about 20 or 25% of what the need might be. And the quality is not managed because the care is not being provided by reproductive specialists, is being provided by, in some cases, primary care physicians or OBGYNs, who in some cases, of course, will do the right thing. But in general, there is evidence that the most cost-effective way and the safest care for fertility care, because it is complicated care, comes from having a specialist providing this and not having it provided by someone with less expertise. So the fact that quality care is not managed is a shortcoming. And then, of course, as mentioned, the cost of care is not managed because the employer often doesn't have any idea what type of care is being provided, and it's not being provided in a way in which there's reports about what's happening. And of course, we think that managing care is important between a good doctor and the patient, not being managed in a group situation where everybody must have this or must have that, because we don't believe that leads to optimal care. So thanks very much, Nick, for that, and we'll move on to the next slide. And what we're going to do now is talk a little bit more about cost, because of course cost is really critical for everyone. So how can employers afford the cost of benefits? On the face of it, it's going to cost them money. Well, there's ways to lower the cost. First of all, to make the program easy to implement. And if you have bundled treatment packages, you can set the pricing up front, especially when you get some discounting in it, which is a very cost-effective way to provide fertility benefits, where you buy a package, but you want to buy a package that's individual for that patient, not one that's just for a whole lot of people, and therefore will have some unneeded services in it for some people, or won't have services that others need. So you want the packages to be evidence-based and individualized. Also, you want to have plans that emphasize the reduction in maternity and NICU costs by having safe pregnancies and single birth outcomes to reduce these costs. And good fertility programs are set up so that they will lower the risk of multiples through not having excessive drug use in ovarian stimulation, and also through replacing only a single embryo. We just talked about elimination of miscoding, which again can provide a lot of savings for employers. And you want to have an innovative payment model, which we'll go over in a minute. So basically, you only pay for what you get, and you don't pay when people aren't using it, which is a huge problem in the healthcare system today. And then you want to lower costs by having it transparent. So, as an employer, an organization, a hospital, you'll know what you're paying and what you're getting for it. And then you can assess whether that, in fact, is what you actually need and want, or whether, in fact, you should change it or do something different. But you need to know what you're doing before you can really manage it. And so with one of the program that we have developed has a very, very low access fee that enables every employee to access unlimited digital and unlimited one-on-one concierge, and we only charge $5 for an employee for a whole year, for an entire year. It's 42 cents a month. And so it's very, very cost effective to put a program in that brings all the education, awareness, and one-on-one navigation and gets people to good doctors. It costs practically nothing. And then there's no per employee per month. So then the employer does not pay a nickel after that until an employee actually uses the program. So there's no cost spread across everybody wondering who's going to use it or what they're going to get. You only pay when it's used and for what people are doing. And on top of that, make it even more affordable by enabling the employer, the hospital, the organization to choose how much subsidy they want to provide. In the US today, the average IVF cycle costs about $27,000. In our program, because of the cost savings, we're under $20,000, just under $20,000. And so the average subsidy put in by organization is $20,000 or $25,000. And we do, however, enable an employer to put in as little as $5,000, and many put in $50,000 or more. But in a program that we're able to offer, the employer has the choice of how much subsidy they want to offer, which really makes it affordable for them. And then again, they only pay up to that amount only when it's used. And of course, reporting is really, really important. And we believe in guaranteeing the products and services we have. And we're happy to discuss that. As a result of all this, we can really create significant cost savings for people. Eliza, you'd like to talk a bit about cost, because we know that's so important in the healthcare system today.
Yeah, absolutely. And thanks for outlining that so well. And I think the one thing I just want to emphasize in what you just shared is that having the long game in mind and understanding downstream costs is incredibly important, because there are a lot of decisions that will happen, as you mentioned, that may impact maternal health care costs later, or NICU costs, which people don't often factor in. So having that perspective in designing the right plan for each patient and each individual becomes incredibly important. And it seems counterintuitive that you would invest in something, but overall be able to sometimes save the employer costs. And that's, again, another very important piece to highlight. And also, I just want to emphasize, for us as a professional physician association with, again, many of our members facing fertility, cost to the individual patient is huge. And especially after finishing medical training with a large debt, being able to afford fertility care becomes sometimes impossible for many. So for employers to offer these types of benefits really helps offload a significant amount of cost on the behalf of the employee. And we've now seen data that people feel more loyal to their employers when they have fertility benefits. The percentage of women coming back to work after pregnancy also is reflected in that loyalty. 70% of millennials now say they would change jobs entirely just to receive fertility benefits. And the culture of that is changing, in that more and more employers are offering benefits. So in the past, while it might have been considered a luxury, it is really now more standard. And the question may be which companies are not covering fertility benefits. And again, hopefully some of the data that David shared really helps allay the fact that the cost piece, with the right perspective and the right partner, can be much more manageable, and in some ways lead to cost savings in the end.
Thanks very much, Eliza. So let's move on to our last section, talking about value, quality, cost, and the third one is flexibility. And, employers almost always want to have benefits to support every employee. And since the path is unique for each employee, we know that each employee needs a lot of options. And the options want to be inclusive to cover all of them. It needs to be comprehensive and then equitable. So everybody is getting, what they need, and flexible. So again, individualized bundled treatment packages that are evidence-based are really important. We believe in providing the latest, best care for everyone, but we also require that anything that goes into packages is evidence-based, because we all know that there's a lot of innovation in medicine, and this is really wonderful. But we really believe that innovation and new treatments need to go through the rigorous process of, research and clinical trials with evidence that shows that they're actually going to help achieve the outcome you want, which in our case is a healthy single baby. And if there are services that have been proposed and may well be commercially available, but have not yet been demonstrated to be of real value, then we do not include them in the packages. And this is another important way of saving money in our field. In particular, there are a lot of services called, quote, add-ons, end of quote, that really are done with the intention of increasing the live birth rate, but in fact have no credible evidence at all that they really work. And so it costs money, but doesn't help achieve your goal. And of course, in some cases, they're not particularly safe because their safety profile's not been well documented either. It's also important to look at the affordability, which is the out-of-pocket cost relative to net disposable income for employees. And we really believe that if you can make it affordable for employers by giving them a very low upfront cost of an access fee, by giving them a choice of how much they're going to pay and then only paying when it's used, we can make it more affordable also for employees when they have to put some funds in by having direct-to-consumer D2C lending, which we've done for over 25 years with unsecured lending to get the best possible additional funds for employees. And so we also provide that service in a seamless fashion and very flexible to bring in. And just a note on the right side, I've already mentioned some of the many things that are needed, but an employee journey can be complex. Not everyone needs all of these treatments, of course, but many people need some of them. And we'll be able to do everything from the home testing or monitoring through genetics, the mail, simple treatments, stimulation, IVF, egg freezing for people who need that for cancer or reproductive planning, third-party reproduction with donor, surrogacy, adoption, a lot of pregnancy navigation, which will show that we can provide that through our partners. We have to manage pregnancy loss and menopause. We have programs for that. And of course, we have a program for lactation, childcare, return to work, and emotional support throughout. These are really important to do. So just
David,
a summary.
there's a question that came up here. Yeah,
Okay.
it says, how do you define infertility? There's so many, which is a great question. There's so many different perspectives on what the qualifiers are as infertility.
That's a fabulous question. So this is the answer. The World Health Organization, for many, many years, infertility was defined as the inability to get pregnant after a year of trying. Inability to get pregnant after a year of trying. This definition was formalized in 2009 by the World Health Organization when they defined infertility as a disease, which was very important because that gives it more credibility when it comes to billing and coding and policy, et cetera. So infertility was defined as a disease that occurred when a couple attempted pregnancy for a year and did not conceive. Importantly, it does not actually include recurrent miscarriage. That's considered a different definition than infertility. Interestingly, the American Medical Association did not define infertility as a disease until 2017. The AMA was 2017. Now, also in that same year, there's a committee called the International Committee for Monitoring ART, or ICMART. I happen to have been on that for 25 years. I've been the chair for 12 years. We are an NSA, non-state actor, or NGO, non-government organization with the World Health Organization. And in 2017, we redefined infertility to include not only the aspect of a disease that resulted from not getting pregnant after a year of trying, which of course by and of itself restricted this definition to heterosexual couples, but we added a clause that also added that infertility also included the inability of an individual, of any individual, to be able to form a family. And it was also defined as a disability as well as a disease. And so by expanding this definition in 2017, which was accepted all over the world by professional organizations, we included single people and those in the LGBTQ+ community. Now, it's important to point out that the World Health Organization has still not changed their definition from one that includes only heterosexual couples. This is a very complex sociologic, political, and also medical question and reason that they have not changed their definition at this time. However, the WHO has called for fertility care to be available to everyone for whatever reason, specifically naming individuals and those in the LGBTQ+ community. And so that's a great question because it has a complex type of answer. Thanks very much for that. So just as a summary about the type of program you want for family forming benefits, you really do want to have something that manages everything from preconception, all the things we've talked about here, through fertility and family forming. And then through our partners, we do pregnancy support with pregnancy counseling for high-risk pregnancies, and benefit plan navigation, because pregnancy leave can be very complex in different states, different employers, and adoption support, which is a very important way to form families. We also, through our partner, have a robust return to work program for assistance, leave benefits, navigation, lactation support, which is critical, parental support, childcare resources. And we also provide after that an ongoing, through our partners, provide menopause support, which is clearly a very rapidly developing area of recognition of need. So Eliza, would you like to talk about some of these issues on flexibility?
Absolutely. Flexibility is so key in this discussion, because as I mentioned early, infertility is a journey, and it's going to be different for every individual. And I think it's important to think about the journey as to even when people are considering some of their options, because sometimes with the right education and support, decisions can be made early on that will alleviate some of the costs later on. And so I think that's really important to have that support for people to have the knowledge. I think for too long, people have not had the knowledge they needed to make the decisions about their fertility options. I think part of flexibility you highlighted so much is that it needs to be affordable, both for the employer, for the employee, for the system, and needs to be done in a way where evidence-based care can be used effectively to help make decisions regarding care. And it's not driven by a one-size-fits-all perspective or a step therapy thing where you have to do this before you're allowed to have this, because again, all of that leads to a waste of cost and also time and energy and inconvenience on behalf of the employee. Also, the flexibility to, pay for the employer to pay when it's actually used is incredible and a huge benefit and a huge cost savings as well. So I just wanted to highlight some of these really important points that come into when you look at plans. Do they have the flexibility that you as an employer need? Flexibility in terms of cost, flexibility in terms of your employee needs, and flexibility to really meet the needs of your entire workforce.
Thanks, Eliza. You'd like to address this slide as well?
Yeah, and so we grappled with this ourselves in AMWA as we were looking for a solution. We were doing a lot of advocacy work in the area of fertility, really trying to encourage healthcare systems to take on fertility benefits. And then we started to look internally. We felt we needed to also walk the talk. And so we needed to find a solution that was flexible and affordable within our budget. We needed to find a solution that would support our advocacy positions. We very much believed in the ability of fertility benefits to achieve DEI goals, not just for AMWA, but also within healthcare, as David mentioned, with the LGBTQ+ population. And, again, wanting to live up to our mission of being a family-friendly employer ourselves. And we had recently expanded staff. And so these became issues that we really wanted to espouse and look into.
Great, thanks very much. And so just as a summary before we begin to wrap up, but how can employers identify high value family forming benefits? We've talked about the quality and cost, which together comprise value, and then the flexibility for all the different methods that we've shown here. That obviously we're going to share these slides and you can read them, but it is possible to bring a high quality program when you have good doctors and evidence-based care. Lower twin rates, and of course the cost has multiple ways, which we've heard can really help reduce the cost to a very low amount, and indeed with a very low subsidy amount. In fact, employers could potentially even save money. And of course, we want to have a lot of flexibility, optional pharmacy plan and optional pregnancy services, return to work services, menopause, et cetera, that employers can choose to include if they'd like to. I see there's another question there.
Yeah, there was a question about what are the key differentiators from other programs out in the family forming benefit delivery.
Yeah, I think these are the three differentiators here. I think we have externally validated superior quality with the lower twin rate, which I think is really critical. And I know that a differentiator for us is our real emphasis on evidence-based care. We do not have any services in our packages that are not evidence-based, and so we stay away from the unnecessary quote add-ons that I mentioned earlier, which unfortunately are very common out there. So quality is important, and the cost, because of our cost design, which is almost no upfront cost for an employer organization. They put our program in at $5 for an employee for a year for unlimited digital and personal access, and then choose how much subsidy they want. That is, both of those are innovative and unique and a differentiator in the space. And then, of course, the fact that they're not paying a PEPM, but only paying when it's actually used. So when the employer is spending the money, they actually know they're getting the return on investment that they've made. So the cost does become very manageable. And then the flexibility to put whatever in or out of the plan that each organization wants, coordinated with any kind of health plan, which we can do, put the pharmacy in or out, other services such, again, pregnancy services, or the return to work or menopause. The organization can decide if they'd like to include them or not include them. So I think these are the three significant differentiators. Another question, April?
There's one more question about, do we use a specific network to deliver the treatment, evidence-based treatment?
Yes, we do have a specific network. We have 400 physicians all over the country. 250 locations. Our in-network doctors provide 1/4 of all the IVF cycles in the country, 1/4 in the country, go through the clinics that we have. We do have an out-of-network option if an employer wants to choose that as well, and we're happy to discuss that in more detail. But our network is 1/4 of the clinics in the country that have committed, top quality doctors that are vetted through a panel of their peers, committed to evidence-based care, and all the care is provided evidence-based way at preset discounted rates to also help save cost. Was
Thank
another
you for that.
question, April? Another question, or?
Yeah, you highlighted on the
Oh, great.
how they're
Okay, good.
vetted. So you answered the
Okay,
question,
great.
both of those
Okay.
questions with one
So
answer. Thank you.
here's our final question. What's the most important to your organization and the family forming benefits? I really want to hear from the audience today, based on what they've heard so far. What aspects of family forming benefits do you think matters the most to your organization? How are the answers going, Nick? Okay, interesting. So across the board, sort of almost equivalent approach. Okay. Thanks very much. So we'll move on now. So Eliza, whoop. Hello, Eliza.
Sorry, I'm on mute. So fertility benefits coverage aligns with AMWA's goals, as I mentioned earlier, and maybe we can just go on to the next slide because I know we're a little short on time. But I wanted to just highlight some of the reasons that we chose ARC Fertility, many of which David already covered. But one, it was offered a flexible, affordable employee benefit that met our budgetary needs. It also offered high quality comprehensive services for employees. We were especially impressed with the fact that these are all physician vetted clinics. We had worked with David. We understand his extensive experience both on a national and international level, and really had that trust in this network of fertility providers that ARC provides. And then, of course, if people are in an area where they can't get to one of those clinics, there is out-of-network coverage. We love the fact that there are resources and care navigators for employees, even at the very beginning of the journey, to help answer questions and guide the process and help them, again, even with early decisions and education that can be helpful later on. We were at the meeting when ARC Fertility won the Validation Institute award for their program. And we very much believed in this physician-founded model of care. And overall, what ARC Fertility has provided us, it has allowed us to achieve our mission of family-friendly benefits. It has allowed us to offer benefits that are very much in line with the work that we are doing and advocating for society as a whole to embrace, and also allowed us to achieve our DEI goals for meeting the needs of a very diverse population, even within our organization and our group. So just wanted to highlight some of those things and how we as a physician-led organization of physicians really felt aligned with ARC Fertility and the program that they put out.
Thanks very much, Eliza. So just wrapping up in terms of how our attendees can act on what they've heard today, I think it's important to assess the value of family-forming benefits to your organization. Is it something that you think matters to you and your people, and determine what your current family-forming benefits are, and then identify any strengths and deficiencies. You've heard a lot of information today about how you can assess aspects of the programs that could be important to you. Compare the available programs that are there and assess them based on the ROI and the VOI to your organization, and then choose the best one for your organization. We have a list of some additional tools here that we'll again be sending to you. We're more than happy to follow up, and we do have references for all the statements that we've made. We're very happy to share any of these peer-reviewed literature publications with you if anyone has any interest, and or to have follow-up conversations. Of course, we'd be happy to talk with anyone if they have more questions or would like to learn more about infertility, fertility care, and family-forming benefits. So thank you very much. Especially want to thank Eliza. I want to thank April, and great deal of thanks to Leapfrog Group and Jill and her team and Nick for making the webinar possible today. I'm not sure, we have a couple of minutes if there are any other questions, April.
Actually, and if I could just add one more point that I think I forgot to mention in our decision process. I think one of the hallmarks of your program, David, was the ability for us to offer benefits to our employees, but have that pay if you need it model, and also where all employees weren't burdened with the same level of cost, only those who needed it. And so that, again, was a really important piece of flexibility for us that helped us meet our budgetary needs.
Thanks very much.
Eliza, great point. And there is another really good question. It is, how do you ensure patient privacy? I imagine employees don't want their employer knowing their fertility struggles or components of their fertility journey.
Well, that's an excellent question, and it's very challenging. Certainly can be challenging, especially because not only for medical information, but within fertility, it's a very, very personal journey, and many people certainly do not want their employers to know. And the way we manage that is we have an enterprise level system, which is entirely HIPAA compliant, and actually we are compliant, have to be compliant with lending regulations as well, and many other business regulations. And so we have the capability of providing reporting back to the employer, to the organization, and to receive eligibility files and manage this in a completely HIPAA compliant way by de-identified data that we can provide the data on individualized basis, aggregated basis, but it's all within HIPAA compliance rules. And so we work out the type of reporting that the organization wants, as aggregated or disaggregated as they want, but always recognizing the need to follow the HIPAA regulations. And we have an enterprise level system that is capable of doing that both for incoming and outgoing data.
Yeah, I'd maybe put a further stamp on it with 27 years of experience supporting not only the direct patient consumer, but now the employer. We have a long you know, a long history of being mindful of these data points and the navigation that's needed for somebody on a fertility journey, supporting 2.4 million people and helping 80,000 people have their families. So very good question, though.
Thank you.
Well, I think that's the last one. Thank you, Dr. Adamson. Thank you, Dr. Chen. Great conversation. We look forward to all of you receiving your materials and the slide deck. And if you have any other questions, you'll know how to reach out to us. It'll be right at the end of the slide deck there with Eliza's contact information and mine for ARC Fertility. But again, thank you again for joining us. We really are grateful that you took time with us today to learn a little bit more about how a high value family forming benefit would look.
Thank you.